Namaskar, myself Dr. Vipul Guljar. I am the Professor Head of the Surgery in Sumandip University, Pipadia, Vadodara. Today, I am going to discuss about the perianal examination in OPD. That means that outdoor patient. Many people want to know how to diagnose first. Then the pictures come for the surgery. How to diagnose is according to need, and according to that we will plan for the surgery. So first of all, I give the many tricks to you. If patient is coming for whatever, the female or the male patient, they should examination under cover. That means you have to cover the except the perianal region. You have to cover the whole the patient with the clothes. That will give us some psychological satisfaction to the patient, especially for the female patient. If we are doing the examination in open area without the curtain or without the female attendance, that may create a problem. Even nowadays, males are more sensitive than the females one to show the private parts. So it is always better to do examination under cover with the curtain, as well as the covering of the body part except the perianal region. Now the position of the patient. Initially, we learned that the patient per rectal examination must be in the left lateral position with the flex one hip joint and keep one leg straight. But with this method, we are not able to examine the properly. So I advise you to knee chest band or the flexion of full hip joint and knee joint, and try to touch knee up to the abdomen level. Then and then you will get a good exposure. Otherwise, the proctoscopy examination, perianal examination, local examination by visual will not be sufficient. In a semi-hip position, flexion of hip, that you can do the per rectal digital examination. No, we need per rectal digital examination, visual examination of the perineum, as well as a proctoscopy examination. That's why I suggest you to do the examination in a flex knee, hip, and bending forward examination. Okay, now the many people are doing the proctoscopy examination without torch, and they are using the mobile. No, because the mobile is giving the dispersed light, while the battery is giving the straight light and yellow light. So this yellow light will be helpful for the examination, not the LED white light or the mobile battery. So always do examination of proctoscopy with the battery only. Now the first per rectal digital examination, or before that the local examination. After the covering of the patient, you have to spread the buttocks with your both the hand and visualize the perianal region. Normally, in a chronic prolapsing piles, there will be some anal verge bulging, and you can see that there is a bulging the perianal piles. That is one indication of third degree prolapsing or the prolapsing piles. So the examination, you can get some information. If anal verge is too much tight or looking at too much tight, and there is a perianal bulging, that is because of the fissure surgery. If fissure surgery is associated with the external piles, this external piles may not require a surgery. Then third is the pelvic floor bulging. That means sometimes in a female Sometimes in a female, old or older age of group of male or the female, you will see the anus is petulated. That means the both the buttock tuberosity as well as anal region is on the same level. That is the indication of pelvic floor descent. That is they are the chronic disease. They are maybe suffering of a pelvic floor descent. If female is there, there may be some urinary problem. You can ask about the incontinence of urine or difficulty in maturation. The male patient may complain of some urinary problem also because of the pelvic floor. By visual, you can put some diagnosis. There may be some chronicity and pelvic floor descent as well as obstructive defecation syndrome also. Sometimes many patients coming with a burning pain perianal region, and they are diagnosed as a fissure. But no, you can ask that the patient having a feeling of pain while defecation or the continuous burning pain. Sometimes these patients are having a pruritus ani, that means some folliculitis or some skin disease over the perianal region because of the chronic sitting position or the some leakage, some constipation may be related with that. But you can see the some folliculitis. This is not a fissure. Sometimes this patient, you can do the rectal examination, you will not find that much fissure in spasm. Then you must not go for the fissure just for because the patient having a burning pain. You definitely ask that patient are feeling a defecation pain or a continuous perianal burning pain. If you spread the buttocks, you can see the fissure. It may extending to the anal verge. So this is also a important diagnostic value only the local examination through the local examination. Now the rectal examination. I would definitely go for the rectal examination. I suggested in the full flex, both the knee and hip and abdomen tuck. I'll do the rectal examination with the xylocaine jelly only. I am not using the Vaseline gauze or Vaseline. Sometimes many people are many institute having a Vaseline box, and in that the surgeons are putting their finger and they do the rectal examination. They will get contamination. Please don't do. Because the patients, the many fissure patient have the patient are having a fissure. They are getting agonizing pain. If you do the rectal examination with the xylocaine, that will give the soothing effect after your examination. So as well as sterile precaution as well as the pain relief for the post PR examination, xylocaine jelly is an important one. During this examination, ask patient to take a deep breath and breathe out also. So this will help the patient to cooperate you very well. In a now there is one question or was arise about the grading of piles. Nowadays grading of piles is not that much important in our practice, but for the paperwork or for the IPD case paper maintenance to understand the disease, for medico legally, for insurance part, we are definitely writing about the grade. In my practice, many or even 50 to 70 percentage my clinical diagnoses in OPD are changed now in a on table examination after giving the anesthesia. So sometimes I was thinking that this is a second degree piles, and they may need a simple laser surgery. But once these patients are taken to the examination under anesthesia, there will be a circumferential problem.
This is how we are covering the patient all the body except the perianal region. It gives some psychological support, male as well as female patient. We have flexed the full knee and the hip joint, and that gives a good exposure. And now I am apply the xylocaine jelly perianal and we doing the rectal examination. This both the knee and both the hip flexion is important for the examination as well as proctoscopy. I am using this multiple proctoscope with the single company, so there won't be a mismatch of female and male obturator. During this insertion, the patient is asked to take a deep breath and out to make a relaxation of the sphincter, and this handle must be towards the sacral cleft only. This is done, and we have to use only the battery, not the mobile light. And for the examination, withdrawal is important. Anterior, posterior, left and right movement of proctoscopy is important. After this, we have to clean that part also. That gives a patient satisfaction fully.